As Nigeria joins the rest of the world to mark 2024 World Malaria Day, the progress in terms of control is being threatened by high prices of commodities. Stakeholders say even though these commodities are free in primary health care facilities, there was need for more sensitization and awareness. Galaxy correspondent Bosan Yakusak has details in this report.
Malaria is a deadly disease caused by mosquito bite, which is quite common in tropical and subtropical countries. The common symptoms of malaria are shaking, chills and high fever. However, this disease is preventable with proper precautions and some preventive measures. Every year, the world celebrates World Malaria Day on April 25, 2024 to raise awareness about the preventive measures against malaria and what can do. And what can be done to ensure that we don't fall victims to this disease. Stakeholders say Nigeria alone accounts to more than 27% of the global malaria burden. The country also records about 55 million cases of malaria and about 90,000 malaria-related deaths.
We supply the anti-malaria drugs, the rapid diagnostic test kits to 746 public health facilities where every citizen can go. If you have fever, you get tested, and if it's positive for malaria, you get the standard treatment, which is the artemisinin combination therapy at no cost to the client. Yeah, so the drugs are available in these 746 public health facilities.
It has an Herculean task as you look at Nigerian perspective. Nigeria is one of the most burdened malaria country in the world. So by so doing, it reduced a lot of issues, lots of productivity, the child under 5 mortality and the rest, and the pregnant women. So it's a very serious disease that kills more than HIV/AIDS, TB and other diseases combined, especially in sub-Saharan Africa.
Some Kaduna residents say community effort is required for malaria to be eradicated, even as government needs to amplify its effort by providing both political will and conducive environment for these to thrive.
To do with the personal hygiene in your house, make sure that you keep your surroundings clean, make sure you clear the bushes and your waste bin is dropped in the proper place. Make sure your gutters, you don't pour waste in your gutters and whatnot, because like the dry season, for sure, and most especially now that the rainy season is getting close, people will not go and dump their waste properly. They'll just dump it in the gutter and that kind of thing, believing that the rains will wash them away, and this will bring about blockages, and this is where mosquitoes definitely they try to grow and things like that and cause this malaria sickness that we are talking about.
About this mosquito nets that we are used to prevent it, that it will not happen again. It was before, but I have not been seeing it again. And if there's anything that government can do about it, so that it will help us.
World Malaria Day urges people to come together to prevent the spread of this disease. This is a platform for international partners, foundations and companies showing their support in eradicating this disease and contributing to getting a better healthcare structure.
This is why we are strengthening social and behavioral communication. We think with continuous sensitization, letting the citizens know what steps or what is their role in this fight, it will go a long way. So we will strengthening sensitization, social behavioral change, just so we know that health is a business for all.
The general public is that take advantage of it, leverage on it. The moment you had a little headache, feverish condition that you felt that is abnormal in your body, rush to a nearest facility. As you know, Kaduna has 255 facilities that are upgraded. And among the 255, there are other facilities in Kaduna State. So there's no community without a single facility, at least a single medical personnel that somebody can rush for at least a rapid diagnosis test to ensure that it is malaria, and he got administered with the appropriate malaria drugs. Because you can't administer drug without being tested. How do you know you have malaria? It may not be malaria, it may be fatigue. Then once somebody begins to take malaria drug without prescription, then it becomes a problem to within the system in the body.